I'll show you today in the next 15 minutes what happens in the middle where you don't enter. Like no insurance agent enters the operating room, right? So what happens in between admission and discharge is what I will talk today. So we do very different way of knee replacement. We don't do a conventional knee replacement anymore. I personally have switched from doing conventional knee replacement to subvastus approach. So the subvastus approach next is basically an approach where this is the horse. This particular tendon, this particular muscle is the one that makes your knee move, right? It is called quadriceps tendon. All knee replacements before 2014 were done by cutting that muscle, right? You cut it here. This is conventional approach where you cut it. So all knee replacements across the globe were done by cutting this and going inside and replacing the knee and coming out. They used to stitch it back. I had a team where we developed an approach called subvastus approach, where we don't cut the muscle, but still we go inside. There is a biological cleavage plane through which we go inside, we do the knee replacement and we come out. So the muscle is not touched, the muscle is not cut. When the muscle is not cut, you don't need too much of physiotherapy. Post-hospitalization costs will come down. When the muscle is not cut, the patient walks the same day. So the duration, length of stay in the hospital comes down. When the muscle is not cut, the pain is less. So the lot of need of painkiller medications will come down. If the muscle is not cut, the patient will go back to cooking. If the lady of 60 years, if she wants to go back to cooking, she can go back to cooking in a week to 10 days. So do you have to believe me? You cannot believe me, right? I'll show you a video. Go next.
चलिए इतना ही चलते हैं आप ऐसे ऐसे कब से चल रहे हैं शाबाश चलिए सीधा चलिए वापस आ जाइए शाबाश शाबाश
Only 7% of orthopedic surgeons can do this across India, right? And only 3 groups of teams in Hyderabad are able to do this kind of approach, which we pioneered and developed in All India Institute of Medical Sciences, New Delhi, which is the biggest hospital in the country. So I'll show you how my results are different. So she's a lady. She has 4 children. All of them are doctors, right? All of them are doctors. She wants the best for her mom. They all want the best. So they got her to me. Play the video, please. So this is her situation before the operation, before the knee replacement. 1 day before. This is when she was admitted. And this is the pain. She's limping. She's in tremendous pain. This is 3 weeks after my knee replacement. Right? You can see how she's walking. You can see the smile in her face. She doesn't need any medicines. The post-hospitalization costs have come down. My operation is not more expensive than a regular operation. So the overall billing, because the length of stay has reduced, so it is much more cheaper. It is much more efficient, cost efficient. So this is the difference of what we do at Gleneagles Global and why our results are way better, little more better than other centers. So now I spoke about knee replacements. Now we also do a lot of hip replacements, and this is a general. I think you might have having a lot of X-rays on your mobiles. Patient will send the X-ray. Sir, will I get an insurance cover for this problem? You don't know what it is. You cannot know, right? Because unfortunately or fortunately you are not a doctor. But this, you can appreciate the right hip is damaged. It is looking odd. It is looking weird. And for the same side, we did a right hip replacement. This is done at our hospital last month, in the month of December. Play the video, please. So, before the operation, go. So, do you think he's normal? He's 81-year-old. He's not normal for an 81-year-old. He's limping, he's struggling, he's having pain. He's unable to walk, he cannot go to the bathroom. This is him 2 weeks. So, this is him 2 weeks after hip replacement. Just 2 weeks after surgery, he is walking without any help, without any assistance, from needing two people to go to the washroom to being completely independent. So this is what happens when a patient is sent for a hip replacement to a right person, and when the right job is done, you will get tremendous results like this. ये गलत है यार, knee replacement के बाद life is never normal, life is never good. You might have heard these things also. After hip replacement, people don't walk, people are bedridden. No, it is wrong. Done well, they give tremendous good results, and the client, your client, will be very thankful to you for getting it done for him with the right surgeon and right doctor, right? Next. So this is, I'll show you one more case. This is a 65-year-old man where the problem is in both the hips, not just one hip, both the hips. So this is how it looks like. When you cut, you see the ball is entirely damaged. This can happen because of age. This can happen because of steroids. Now, how many of you heard that steroids were used a lot in COVID? Yes? During COVID, you have done a lot of approvals, lot of discharges. You might have seen a lot of steroids were used during COVID. COVID pandemic is over. COVID side effect pandemic has begun. COVID pandemic is over. The side effects of COVID pandemic has just begun. So all people should be educated to renew their insurances, isn't it? So next, first video, please. So in the first video, I'll try to briefly show how he was walking. He's a 65-year-old gentleman. So this was his walk before the operation. Both hips are damaged, struggling to walk. And this is his video at 4 weeks after the operation. What do you think? From this to this. So if done well, it works like magic. Getting an operation done is not a big deal. Getting a good operation done is a big deal. In today's date and time, getting operation done is no big deal. सुबह दाखिल हो जाइए, शाम को कर देंगे. No. Getting a good operation done, getting a right operation done is a very big deal. Right? Next.